Today came the shocking news that reality TV star Poonam Pandey has passed away. She was only 32 years old. As per the claims being made by her team on social media, the death was caused by cervical cancer. This development has sparked shock and disbelief, especially because the images that came out from just 3 days ago showed her as almost hale and hearty. The post that was made by Poonam Pandey's team on her Instagram handle today said that this morning is a tough one for us, deeply saddened to inform you that we have lost our beloved Poonam to cervical cancer. Every living form that ever came in contact with her was met with pure love and kindness. In this time of grief, we would request for privacy while we remember her fondly for all that we shared. Now take a look at those images that have raised many concerns as well as speculations around the circumstances of her demise. The first set of visuals is from the 30th of January when she posted pictures of her partying in Goa. That is just 3 days ago. The second image is from the 25th of January, where she posted a selfie on Instagram, and then came the sudden announcement today of her passing away. People are now mourning her death. So, is it possible for somebody who was partying 3 days ago to suddenly fall prey at hands of cervical cancer, which ironically has been known as the silent killer? To help us understand that and other questions around this, we are now joined by Dr. Smita Joshi, who's a preventive oncologist, a senior scientist at Prayas, a Pune program director, JCDC, and project consultant, Grant Medical Foundation, Ruby Hall Clinic. Ms. Joshi, first of all, tell us about cervical cancer. Why is it called the silent killer?
Yeah, thank you for having me. And see, cervical cancer is caused by a virus. The name of the virus is human papilloma virus. And there are certain high-risk types of this human papilloma virus that infect us actually when we start our sexual debut. So that's the period when someone gets infected with this virus. And we now have actually to power already exposed to sex. We have a screening test. So all adult women must undergo the screening test. You might have heard about cytology or pap smear screening. We now have something that is more powerful than cytology or pap smear. We have the HPV detection test. So if someone has HPV infection, then we can go ahead with certain other investigations. And then if there is any abnormality, we can treat that lesion on the cervix. Therefore, if this precancerous cervical cancer is something that can be detected in the precancer stage. Okay. All cancers have a stage when there is precancer, but not all cancers can be detected, or precancers can be detected for all cancers. Cervical cancer, in a way, we have these tools to prevent this cancer. We have
but see, why we're having a conversation about this today is because of not only because a famous face has fallen prey reportedly to this, but also because of the suddenness of it all. Can it happen that it can go undetected for the longest time and then lead to sudden death?
Yeah, so when it is in the precancer stage, there are no symptoms, and that's the time women have to go forward and get the screening test done.
So okay, so how does one, does it have to be preemptive, or is there any symptom at all that can trigger that response in terms of going for a check?
So in the precancer stage, there are no symptoms. So all women, practically all women above the age of 30 must get that screening test done. It is irrespective of your symptoms. When symptoms start appearing, the symptoms can be, bleeding after sexual contact, or bleeding during the 2 menstrual periods, or bleeding after your menopause. That is the time when we have symptoms. That's the time when the disease is in an advanced stage. So the screening is for healthy population. The screening is for women who have no symptoms. And therefore, I said all women above the age of 30 must get screened with an HPV test.
Okay.
And if this HPV test is positive, then they can undergo some other test like colposcopy, biopsy, and treatment of precancer. The treatment of precancer is very simple. It's an OPD procedure. And then if we detect this precancer early, and if we treat that appropriately, cervical cancer can be prevented.
Okay, and what if the detection happens in later stages?
So that when the detection happens in the later stage, that means the disease is advanced. It is probably not in the pre-cancer stage, and then it is in the cancer stage, and then we have to go for the anti-cancer treatment, which
And
can be
the chances of recovery in that case?
the chances of recovery. If it is detected early, then the recovery chances are good. However, whenever we detect a cancer, we talk about 5 year survival. So there is always a risk of recurrence, persistence. Someone needs surgery or radiotherapy or chemotherapy. The treatment is prolonged, the treatment is expensive, and the recovery is not guaranteed in all cases.
Okay, and could it also happen that because most of the symptoms that you suggested also happen with women because they go through periods every month, bleeding is almost considered to be a normal thing. Is there any other way that women can be aware of this kind of disease apart from regular test? You said the pap test that you spoke about, because when it comes to women, they don't really pay attention to their personal health because of whatever reasons, financial or otherwise.
Yeah, first of all, it is not the pap test that is recommended now by the World Health Organization. It is the HPV test.
Oh.
So if HPV is positive, if someone is infected with HPV, then we can detect the precancer stage more accurately. HPV test can very accurately, very correctly identify women who are at a risk.
All right.
And then
right, preemptive screening and taking steps well in time is probably the only way to stay safe, stay healthy. Thank you, ma'am, for joining us and clarifying all those confusions. We take a very quick break.